Greetings, Professor and classmates. I'm Dwayne Salam, and this PowerPoint presentation is on EMDR, psychodrama, and having therapy for the treatment of anxiety. One of the first things we must establish is what is anxiety? According to Hashim and others, anxiety is a chronic condition that is characterized by excessive fear, worry, and nervousness that can interfere with daily functioning. Anxiety differs from stress in that stress is a temporary state of mental or physical strain caused by internal or external factors. Again, stress can be a short-term condition and it can be a response to a recognized threat, whereas anxiety can linger and may not have a identifiable trigger. So what is EMDR therapy? EMDR stands for eye movement desensitization and reprocessing. EMDR therapy is a structured psychotherapy used to help resolve upsetting memories. Psychologist Francine Shapiro first developed EMDR in the late 1980s. EMDR integrates elements of different psychotherapeutic modalities along with sensory stimulation to assist brain functioning. The concept behind EMDR therapy is that traumatic memories that are unprocessed become stuck in the brain. These stuck memories can lead to a range of emotional and psychological difficulties. During MDR sessions, the therapist guides the patient through the procedures designed to stimulate bilateral brain activity. This stimulation can be achieved through various methods such as side-to-side eye movements. Although eye movement is a key component of this therapy, other bilateral brain stimulation techniques such as altering sounds between left and right ears, as well as tapping on the shoulders or knees, can be applied as an alternative to eye movements. Some clients come to EMDR sessions fully aware of what their triggers are, while others may be unaware of their triggering events. The goal of MDR therapy is to help individuals process through and reduce the impact of traumatic events and traumatic memories. EMDR therapy is divided into 8 stages. Stage 1 is history taking and treatment planning. The history taking and treatment planning stage is when the therapist gathers a comprehensive history of the client, establishes the therapeutic relationship between the therapist and the client, and develops a treatment plan to address targets such as past traumatic experiences, current triggers, and the client's personal goals. It is essential to note that MDR may not be suitable for everyone. Individuals who have a respiratory or cardiac problems, pregnant women need to consult their physicians before engaging in MDR therapy. Stage 2 is preparation. During the preparation stage, the therapist explains the MDR process, teaches the client coping skills, and helps the client develop emotional management skills, such as creating a mental safe place and an emotional container. Stage 3 is assessment. The assessment stage takes place when the therapist and client identify memories to be targeted for processing. This includes associated negative thoughts, beliefs, emotions, and physical sensations. Stage 4 is desensitization. Desensitization is the stage where bilateral stimulation is used to aid the client in processing their target memories. During the desensitization stage, bilateral, auditory, tactile, or eye movement stimulation is used to enhance brain processing. After each set of stimulation, the therapist will ask the client about their experiences and rate and monitor their progress. Stage 5 is installation stage. The purpose of the installation phase or stage is to install and reinforce positive beliefs, ensuring they remain durable in future situations. Stage 6 is called body scan. During the body scanning stage or phase of EMDR therapy, the client holds and identifies memories and the optimist belief in mind while scanning previous tensions or sensations. Stage 7 is closure. Closure in MDR is when the therapist provides a sense of closure and summarizes the session. Additionally, the therapist will remind the client about availability of resources for continued processing. Stage 8 is reevaluation. Stage 8, the final stage of EMDR therapy, is when the client and the clinician reevaluate the process achieved and reassess the level of disturbance associated with target memory or memories to ensure the desired resolution. EMDR sessions typically last between 60 to 90 minutes. Though the length of sessions may vary, the number of sessions will also vary depending on the client's need. Typically, EMDR involves 6 to 12 individual sessions. The next subject here is psychodrama therapy. What is it and how does it work? Psychodrama therapy is a psychotherapy that utilizes role-playing and dramatic techniques to aid individuals in exploring and resolving emotional issues. Psychodrama therapy works by having the protagonist, which is the client, act out past negative experiences or conflicts within a group setting. These sessions are led by a trained therapist who acts as the director and are supported by group members, the audience. Though conducted in a group setting, psychodrama therapy is considered an individualized therapy, as the group members only play supportive roles. Psychodrama therapy starts with a warm-up. During the warm-ups, group members engage in exercises to foster interaction, create a sense of comfort in sharing, and build spontaneity. Psychodrama therapy is divided into different phases. The next phase is the action phase. During the action phase, the protagonist is chosen as the primary focus of the session. Scene creation occurs where the protagonist aids the director and the group members in creating scenes based on the protagonist's past experiences. Then role-playing occurs as group members play roles in the protagonist's story. Psychodrama therapy techniques include role reversal, where the protagonist switches roles with a group member to gain a deeper understanding of their perspectives. Doubling may occur when group members take on the role of the protagonist to express unspoken thoughts or feelings to aid the protagonist in understanding things from the point of view of others. Future projection is when the group acts out potential future scenarios to explore possibilities. The next phase is the sharing phase. After the action phase is concluded, the group members come together to discuss, reflect, integrate, and process the experiences. The benefits of psychodrama therapy are trauma processing, skill development, emotional expression, and increased empathy. The next therapy is happening therapy. What is happening therapy and how does it work? Happening therapy is a type of psychotherapy that utilizes touch, attention, and imagination to aid individuals in reducing emotional distress and anxiety related to traumatic experiences. Happening therapy involves identifying and rating distressing memories, engaging in forms of self-soothing such as self-touching, using distractions like counting, visualizing, or humming, and then re-rating distress to decrease its intensity until reaching the level of zero distress. Christian worldview integration. EMDR, psychodrama, and happening therapy are not inherently aligned with a biblical or Christian-based worldview, nor do these therapeutic modalities have a spiritual base configured within their fundamental structure. Despite this fact, these therapeutic approaches are adaptable to fit a Christian counseling perspective through the adoption of a God-centered and biblically aligned narrative that can be seamlessly interwoven into these psychotherapy models. According to Vientin and others, the integration of religion and spirituality into a mental health practice can be a protective factor against the development of traumatic symptoms. Now, faith is confidence in what we hope for and assurance about what we do not see. New International Version, Hebrews 11:1. This faith, confidence, and hope can play a pivotal role in overcoming adversity. I thank you for your time, and I hope you enjoyed this presentation.